Good evening. My name is Jean Nagelkirk, and I'm the Vice Provost for Health at Grand Valley State University. On behalf of the Your Health Lecture Series partners, which include Michigan State University College of Human Medicine, Spectrum Health Systems, and Grand Valley, welcome to our 8th annual lecture. Tonight's panel presentation is titled The Impact of COVID on the Elderly. Although we would prefer that you be with us in person, networking at our reception, and having fun together, we're pleased that you were able to join us today. COVID-19 has impacted everyone, but it has been especially challenging for the elderly population as they are at a higher risk of hospitalization and complications. According to the Center for Disease Control, as age increases, so does the risk of morbidity and mortality, with the greatest risk for those 85 years of age and older, who are at 13 times more likely to be hospitalized than a person 18 to 29 years of age. In addition to an increased risk of hospitalization and complications, they also face negative mental health impacts, often resulting from a lack of socialization due to isolation and/or quarantine, which may result in feelings of loneliness or depression. Today, our expert panelists will discuss the impact of the pandemic on the elderly, sharing state, regional, and local initiatives and resources to help older adults, family caregivers, and staff providing the care during this time of the pandemic. The annual lecture series today is an exemplar of 2 universities and a health system collaborating to share important health information with our community. Our 3 organizations are founding members of the Midwest Interprofessional Practice Education and Research Center, which is designed to infuse interprofessional education and team-based care into our community to improve the quality of health care that each of our citizens receive daily. I would like to provide a special welcome to the students in attendance tonight. It's important that our medical, nursing, and health professional students have an opportunity to learn more about caring for individuals at each stage in their life in an interprofessional, team-based model. Grand Valley has committed significant resources to assist in developing the healthcare talent pipeline for our communities. In fact, we have more than 9,000 students enrolled in one of our 65 health-related programs. And Michigan State University College of Human Medicine provides education to 346 medical students in Grand Rapids. I would like to thank Brian Ulrich, the Director of the Interprofessional Education Center at Grand Valley, and Diane Dykstra, our Events Coordinator, as well as Mark Breeby, Director of Community and Governmental Relations, and Nikki Lechner, Events and Community Initiatives Manager of Michigan State University College of Human Medicine, for planning and coordinating tonight's event. While you are listening to our expert panelists this evening, please submit your questions using the Q&A function at the bottom of your screen. We will do our best to answer as many questions as possible. Now, I have the privilege of introducing tonight's speakers. Our first speaker is Ann Elmerts, the Director of Contracted Services and Program Development at the Area Agency on Aging of Western Michigan. The program that Ann has developed includes the Family Caregiver University, which provides practical education and support to caregivers in West Michigan, and Handy Helen classes, which are designed to empower older female caregivers with the skills they need to tackle minor home maintenance projects. She also has been involved with developing and leading the Dementia Friendly Initiative in Grand Rapids, as well as across the state, and has a bachelor's degree in social work and a master's degree in public administration. Ann?
Thank you. So it was Sunday night, March 15th, 2020, and across the country, we were hearing of schools and businesses starting to close, and we already knew that older adults were at high risk of getting COVID-19. I heard from our Healthy Aging Contract Administrator, Barb Nelson Jandernoa, texting me asking about stopping the wellness room classes. We went back and forth about the ramifications for it. That social interaction with the positive health benefits for the older adults, man, that was going to be really hard to stop. Nevertheless, the next day, Barb went online with a brief video encouraging her older participants to get off the couch, keep moving, and promised them that the classes would go virtual in a very short time. That was 10 months ago. And as of Monday, Michigan reported a total of 538,377 confirmed COVID cases and 13,824 deaths. Adults age 60 and over, they represent 23% of the cases and startling 90% of the deaths. During this time, older adults have continued to receive support and services, although it looks different than pre-COVID. So I'd like to take the next few minutes and report about how, with the support of federal initiatives and funding, and with the collaboration of our amazing partners, that we've been able to do that. So that slide there, it shows the counties. To give you context to our AAA, those are the counties that we serve. And our mission is to help older adults and persons with disabilities get the services they need to stay in their home. So on the next slide, what I would like to report on is some federal and state support that's happened during COVID. Within a very short period of time, we did receive federal funds through our State Office on Aging that we contracted out to our service partners. The FFCRA allowed our service partners to provide an additional 108,000 meals, and the CARES Act provided an additional 176,000 meals. This was in addition to the more than 900,000 meals provided throughout our region with our regular Older American Act funds. You can see food for our older adults, that nutrition, that has been so important, such a high priority during this pandemic. Very quickly, our nutrition contract administrator, Stacy Gherkin, all the nutrition partners throughout our region, they had to pivot quickly to prepare for a very dramatic increase of the number of meals for older adults in our region, since it had to go to their homes because the meal sites were closed. With that CARES Act funding, we were also able to help our partners get what they needed to work remotely and continue to provide services. In the beginning, you all remember how hard it was to get that PPE. It was a high priority to help our partners get it, and we're continuing to do that in 2021. There was also big help with an advocacy push at federal and state level to offer the direct care worker hazard pay, which offers an additional $2 an hour for our in-home workers and our adult day program. And that has been a real encouragement to our frontline workers. We worked with USDA and Farmers to Families, collaborating throughout the Aging Network to get produce boxes, food boxes to older adults. We worked with our State Office on Aging. Blue Cross Blue Shield was a great partner. We distributed more than 2,000 COVID-19 care kits, and they were intended to help older adults with personal care items and socialization activities, with the idea of limiting the amount of times that an older adult had to leave their home. So you can see these were really helpful services, but it still meant the older adults were in their homes and being isolated. The next slide is going to focus on millage. So at the end of March, in collaboration with our millage partners, we developed a new service, COVID-19 Senior Support. So while many of the millage services went on pause due to Governor Whitmer's executive orders, this service was designed to help older adults still get the essential services that they needed, provided wellness checks, phone calls. So here's an example. Pre-COVID, an older adult could get transportation to go grocery shopping, get meat, meal, medications, different things that they needed. During COVID, agencies were the ones who were going out and getting the services for the people and bringing it to their homes. So it's an example of how they're getting the services, but in a way they're still being isolated in their homes. Our service partners have always worked so well together, and they have really stepped up during this very, very challenging time. Another way that our Aging Network has continued to provide services is through virtual programming. And so the next slide is going to talk about some of the different programs that we were able to get online. Pre-COVID, we really didn't offer anything like that. It was just more in person, which was wonderful. So it definitely was a little bit of a learning curve, as it has been for probably all of us, learning how to get these type of programs and classes online. We made it happen. Attendance has been great. So here's an example of some of our services that are partners that we've collaborated with, and we've been able to get them online. Dementia Friends is classes to help people learn more about dementia and to help persons with dementia navigate easily through the community. I mentioned our wellness room, our Eagle Crest Healthy Aging. There's a wide variety of classes Monday through Friday, real-time classes on Zoom, and also videos. One of our partners, Senior Neighbors, has done an awesome job throughout the community getting classes online as well. One of our contract administrators, Kendrick Heinlein, he actually did this pre-COVID, but he had developed a number of making IT easier videos, which helps older adults learn how to use their cell phones and FaceTime and Skype. And now Zoom, that was another one that was added. So as I said, these were made pre-COVID. We had no idea how much they would be needed now. We have our Kent County Elder Abuse Prevent Coalition. Our contract administrator, Cassie Schrock, leads that charge. So their meetings have gone online. A lot of materials have been produced and are available on website and different types of social media. And also folks from the coalition and Cassie are available to go out and speak to older adults virtually at this time. You know, those scams, they don't stop for older adults. And now we're even hearing about vaccination scams. So that's just another way of trying to keep our older adults educated. Then the last one on this page here is this Get Set Up. This is a new initiative this year during COVID from the State Office on Aging. And it is a great website. There's more than 150 technology and entertainment classes that are available at no cost, and they are taught by retired educators. As of last week, there were more than 35,000 older Michiganders who have taken some of the classes. And I looked to see what the top 4 classes are. First one is getting started with Zoom. The second one is scheduling Zoom, and then conquering negative thinking, and also like visiting virtual museums and tours along those lines. So all of these virtual offerings, they provide great connection, but they're not in person. And the next slide frames a different way for us to address social distancing. So our caregiver contract administrator, Sarah Sobel, had recognized back in early spring that the stay-at-home order was going to be really hard on older adults, as we know that isolation is so detrimental to the health of our older adults. She put together many classes addressing mental health issues for older adults and family caregivers. One of the class speakers said, rather than saying social distancing, call it physical distancing. It's key that you remain social even while apart. That quote has stayed with all of us and encourages us to continue to develop and promote programming and classes that keep our older adults connected. So on the next slide, I'll give a few more examples. Back in June, Sarah worked with a local counselor, Julie Alke, to start a weekly virtual family caregiver support group. It is a great resource for family caregivers to connect with one another and share their experiences. And with the support of Spectrum Health Healthier Communities, a grant from them, we're able to continue it in 2021. We're really thankful for that. The right side of the slide is the Stay Well initiative. And I encourage you to visit their website if you or someone you know is experiencing some mental health issues or substance abuse. You can call the number on the screen. You get connected to a Michigan Stay Well counselor. And in just about every training that we do now, every meeting, we either have someone from the Stay Well initiative address our participants, or we include the contact information. It's just that important to keep talking about mental health. So we've been talking about older adults in our community, but there's also our long-term care ombudsman. So on the next slide, you can see there's a website address where you can get some helpful information. We have ombudsmen who are working out of our office. There's 2 of them. They cover our whole region, and they are still very busy. They cannot go out in the homes. They haven't been out in the facility since March. So they're working with families over the phone, trying to help them with their compassionate care visits that they want to make, Some facilities are experiencing some severe shortages, and so issues are rising from that. So they're pretty busy. The phone number is there if you want to call them. The long-term care facility residents are experiencing such loneliness, it's heartbreaking. One of our ombudsmen, Kay Sholey, mentioned the community could help out by calling activity directors at facilities, asking them what you could do to help out. Can you drop off an old Kindle, an old tablet? Could you arrange to be a Zoom buddy one-on-one, be a pen pal, go to the dollar store and pick up word searches, crossword puzzles? There's a variety of things that you might want to consider doing. It's going to be a while before facilities are open to visitors, so I offer a call of action to the community to help out. So in wrapping up, I'd like to again highlight something that makes Kent County stand out as a great place to age in our community. We have more than $12 million in service funding for 2021. Right now, with some group setting type programming still on pause, the service can look a little bit different. But here in our community, we have more than 34 agencies who are helping out, providing some wonderful service. There's more than 56 unique services, and they are willing to help out also with the vaccinations and to transport people. So our Millage partners are very involved in many different ways during the pandemic to help see our older adults through this. On the last slide is just some resources. So I have mentioned quite a few things in the last few minutes, but I wanted you to have an idea of what's gone on during this pandemic, the federal, state, local support that we've received, the partners who are out there working very hard to help the older adults and family caregivers. It's happening. So there are many resources that you can access by some of those on the page there. Also, if you have information to share, we will share it. We want to share information from our partners in the community for things that you're doing to help older adults and family caregivers as well. We are all in this together. And I encourage you to continue to check in on your elderly neighbors, your family members, and see how you might support them.
Thank you, Anne, for that wonderful presentation, sharing the resources available for elderly and their caregivers. Thank you again. Our second speaker tonight will be Dr. Becky Davis, a professor and associate dean for research and scholarship at the Kirkhof College of Nursing at Grand Valley State University. Through grants from the John A. Hartford Foundation and the National Institutes of Health, her program of research has focused on providing supportive environments for persons with Alzheimer's disease. She was also recently awarded an R01 research grant from the National Institutes on Aging to study ways to improve wayfinding in persons with cognitive impairment. She is a fellow of the Gerontological Society of America and a past John A. Hartford Clare M. Fagan Fellow. Dr. Davis has received numerous awards for her teaching and research. Dr. Davis?
Hello, thank you very much. I'm going to share my screen here. So I'm going to be talking to you today about social isolation during COVID-19. And I really want to thank Anne for that wonderful presentation, because I learned about a lot of resources that I didn't even know about. And I wish I could add some of those to my slides, but certainly something we can keep in mind as we go through this presentation. So the state of Michigan, probably most of you know, but the state of Michigan limits visitation right now due to COVID in long-term care settings. In order to have a visitor, you have to meet certain criteria. For example, you have to need compassionate care, perhaps if you are expected to die. Outside visitation was allowed over the summer, where people could meet under certain circumstances outdoors, but this is Michigan, and so that's not so helpful right now, is it? And so right now, people have been, and that live in long-term care settings, have been going without family visitors for a really long period of time. In addition to that, in the community, there's been very strong recommendations for older people to be physically distanced from others. And most older people that I know in my clinical work and just family members and friends have been taking this pretty seriously. In the beginning, people didn't even go to the grocery store or anything like that. Maybe people are doing a little bit more of that, but wearing a mask and not doing the gatherings that older people so much enjoy to do. So when we talk about social isolation, we also can talk about loneliness. There is a difference. Some people can be isolated and not alone. Other people can be isolated and feel lonely. And so there's been a lot of research in the psychological literature on loneliness itself. And basically what the research shows is about 25% of people, when you do a measure of loneliness, state that they are lonely in today's world. So loneliness is already kind of a problem. And then on top of that, we are adding in social isolation to people who perhaps already have felt lonely. And so that can actually be a compounded problem. The research that's been done during COVID has been just fascinating. I did a little lit review before putting this presentation together. And one of the things that was so fascinating to me and should not be surprising is that older people are actually less likely to feel lonely than young people. And that's been attributed to their resilience and the fact that they have lived their life and they have experiences that they draw upon in order to cope. However, certain factors for any people, especially older people, may relate to loneliness. So people that live alone, that have a lower income, that maybe have had prior depression or anxiety or other mental health issues may be at a higher risk, or they are at higher risk for being lonely. But older age as a factor all by itself appears to actually be protective from loneliness, which is a good thing. This is a very interesting study that was done looking at lockdown status and loneliness. And if you look at the red line there is our states are where lockdowns have been in place. And the blue is where lockdown status have not been in place. And this is going from April until September of this past year. And if you look, there's been a gradual increase in loneliness across the board. However, it's been much worse in the states that have been locked down, and that would be Michigan as well. So we would expect that we would have more loneliness and high loneliness because of the fact that we've been locked down and people have been really kept from their activities. So why is that a concern? It's been almost a year. If we think about that, it's a long time. There's a great deal of research that talks about the importance of social connectedness and what happens when we don't have that in our lives. They've done studies on animals all the way to humans and have shown that social connections are ideal and very, very essential just for well-being at all. People that are socially isolated are more likely to have anxiety, depression, poor sleep problems, physical inactivity, and even morbidity such as death. There's a 25% increase in death rates in people who report themselves as being lonely. There's very strong evidence that socialization is related to health, longevity, and quality of life. So when we look at a time that we've never experienced, such as having this pandemic in our life, we really are looking at this risks of getting this terrible disease of COVID and the equally bad risks of social isolation. So it's not so easy as to say, okay, lock yourself up in the house and don't come out, because there's some pretty profound effects that can happen, including death from social isolation. And so especially in certain people. So there have been some recommendations for older people for what can you do in order to be as healthy as you can during this time. So of course you want to do all the things that they tell you to do: wear a mask, wash your hands, stay away from large crowds, all of those things to prevent getting COVID. In addition, there needs to be a plan put in place for staying healthy and combating some of those consequences of social isolation. The things that they recommend have to do with exercise. And I know exercise. And so it's very important to make yourself do the exercise. Aerobic, strength, flexibility, coordination, balance, and stretching. Those are the ones that are recommended by the National Institute on Aging And it's really been stated that this is very important during this time. Doing things like crossword puzzles and other activities to improve cognitive abilities, taking some of these classes that are available online through the Area Agency on Aging would be an excellent idea. These kinds of things can improve sleep, and sleep is very important to well-being. The last one I think is especially hard in Michigan, and that is to reduce sedentary behavior. I know that since COVID, my behavior has been more sedentary because I literally work continuously on Zoom. And so it takes a lot of effort to get that physical activity in, but it is very important and can't be understated. So one of the things that reading all the literature that I suggest is to think about creating a new routine. You can't go to the senior groups and the clubs and the activities perhaps that you might want to do that are in large groups, but you can create a new routine that might have to do with doing some things via online, phone, video, exercise, and those incorporating those aspects into your life. Create a small bubble of friends who socially distance from each other and from others. For example, here I'm in Florida this week, and I've noticed that there are these older adults that are at the end of the driveway every day. And of course, we can be outside, but they're outside socially distanced with masks, and they meet every day to kind of compare their life. And so that's just a great way to keep a connection. Keep in touch frequently with family. This is a great time to get the grandkids involved in keeping in touch. Work with family and friends to keep positive. One of the things they actually recommend is don't watch too much news because the news can be sort of a drag, at least this past year. Try to learn something new, make it a challenge, and create a plan to do one new thing every single day. Don't just let it kind of suck you in. You've got to try to do a new thing. Okay, so my mom is 87, and she told me, she said, just don't tell them that Zoom is the answer and Facebook is the answer to everything. So I'm not going to tell you that, but I am going to tell you that it is an awesome way to have a facial and a little bit better than just a phone call for people that have access. And so Zoom, FaceTime really is a great way to have interaction. Once a week or so, my mom and my 3 daughters and I get together on a Zoom call. We pour ourselves a glass of wine. We all knit and we chit chat and we laugh, and it's very healthy even for me and for my girls and for my mom. I have found that I've had to help my mom learn the technology. She didn't grow up using Zoom, and so older people can struggle with the technology and will need assistance, and watching some of the online videos, for example, might be helpful, but they may need actual assistance from somebody in their life. There are some special tablets that you can get for people that may struggle with iPads or other types of tablets, and I'll show you a picture of that in a minute. Remember that this doesn't really replace face-to-face, but it's better than nothing. It can be frustrating. I have had some older folks who've told me it just makes them very nervous. And so me being patient has helped. And actually my daughter helps my mom quite a bit with her technology just because she's young and she's better at it than I am. So I appreciate that. There are free classes online, as Ann Ellermets told us about as well. There is a site called Senior Planet, and I have the website here that has just tons of different course offerings for people that are interested in learning those. Here's a couple different types of technologies. There's many types of technologies. This is, on the left, you'll see a picture of a phone. And this is a phone that is called Raz, and it's super easy to use. And for someone who perhaps might have a cognitive disability, this would be fantastic because there's a face and you press the face and it makes a phone call. And so it's really quite snappy. This does require some, a subscription, just like any phone plan. On the right is something called a GrandPad. And so you can look this up online, and I have put the link on the slides as well, but it's like an iPad, but it's super easy. It's a lot easier than an iPad. You just press the button and make a phone call to email. You can do video conferencing with it. And it also does require purchasing it and having a subscription to their program. So those are just some ideas. The Alzheimer's Association also has a list of technologies that might be helpful if people are working with people that have dementia. But these are really great for really anybody who has any problem working with technology. So for long-term care, might wrap it up, there are a lot of considerations. One of the concerns that I've had as a nurse is that in long-term care, family members are essential for the well-being of their loved ones because they know them and they can kind of keep an eye and to make sure that things are going well. So it's really important that family members stay in touch and if possible by video so they can lay eyes on their relative. So the staff should be helping with that if at all possible. Watch for symptoms of failing to thrive, social isolation, such as weight loss, confusion, poor health as a result of isolation and inactivity. So in summary, older people are resilient and we cannot underestimate their ability to cope. They can cope through this, and we're going to get through it and it's going to get better. Those with prior risk factors of loneliness are more likely to have some problems and may need some intervention. Older adults in long-term care still need monitoring by family. Weighing the risks of activities is important. Creating a plan and learning new things can help. So thank you.
Thank you, Dr. Davis, for your presentation and sharing information about social isolation, connectedness, healthy behaviors, and how to make a plan to stay as healthy as possible with specific resources. Thank you again. I would invite participants to put any of their questions they have in the QA box because after Dr. Ensberg presents, we will take Q&As. So our final panelist tonight is Dr. Mark Ensberg, a geriatrician at the Holt Senior Care and Rehabilitation Center in Holt, Michigan. He provides care for patients receiving short-term rehabilitation services after hospitalization, as well as for long-term care residents. He is an associate professor of geriatrics in the Department of Family Medicine at Michigan State University. He received his medical degree from the University of South Dakota. This was followed by a residency in internal medicine. He completed a geriatric fellowship at the University of Michigan and was the lead trainer for Geriatric Education Center of Michigan at Michigan State. Dr. Ensberg is board certified in geriatric medicine and hospice and palliative care. Dr. Ensberg.
Thank you very much for the introduction. I care for patients in a 110-bed nursing home in Lansing. About half of the residents that I see are in long-term care. The other half are at the facility to get rehabilitation after hospitalization before going home. Last March, our nursing home took several steps to prevent COVID-19 from spreading through the facility. The social isolation, and I use the word social isolation because that indeed is what it is, that was necessary to prevent COVID had its consequences. We saw anxiety, depression, increased behaviors associated with dementia, and decline both physically and cognitively. In this presentation, I'm going to tell the stories of 5 people for whom I provided care and offer some possible solutions. But first, I need to tell you that our nursing home has an outstanding infection control nurse. This nurse and her team took appropriate steps to reduce the likelihood that COVID would spread through our facility. These measures included closing the dining room and having meals in the room, stopping large group activities, stopping visitation by families. Patients coming from the hospital were placed in a private room and restricted to that room for 2 weeks. I think the most impressive thing, though, that our infection control nurse did was create an environment where front staff are vigilant, but they feel safe. Staff who feel safe will not limit their time with residents and will take the time that is needed to provide necessary care for their patients, whether it's helping them eat, getting them to the bathroom, or doing their physical therapy. I have a tremendous amount of respect for our frontline faculty, our frontline staff at the nursing home who did a lot of work over the past 9 months. As I look back at our experience in our nursing home, my biggest critique is that the right things were done by exception rather than as a part of an organized plan to increase socialization. 2 examples. Teresa is an 84-year-old with Alzheimer's and a fractured hip. Prior to COVID, she would wander about the dementia unit in a wheelchair. She had her eyes on a younger 75-year-old man at the opposite end of the hallway, and she would seek him out for companionship. Post-COVID, the dining room was closed, activity rooms were closed, but you cannot stop a wanderer from wandering, and there was increased congestion in our hallways. For Teresa, this meant more obstacles to get to her man. If someone was in the way, she would say something, and if that did not get results, she would do something. And what she said and what she did was not necessarily nice. A very bright young activities person made an observation and asked a question. This person says, it doesn't appear that the residents on our hallway are physically distanced. Why not open up the activities room for 4 or 5 residents, have some activities and decrease the congestion? The concern, though, or the perception, I should say, was that we might be going against the recommendations of public health. So it was discussed with our infection control nurse, and an exception was made. We opened up the activity room, and it worked very well. A second example, Ellie is a 63-year-old lady with multiple sclerosis, a very good mind, but physically impaired. Pre-COVID, she was able to use her scooter to go around the facility, an electric scooter. Post-COVID, she was restricted to her room. What about FaceTime? Well, that did work very well, and she talked to family perhaps more than pre-COVID. What about a window visit? That worked well also, but she still had cabin fever and was very anxious. And again, a nurse advocated for her. Why can't we put a mask on her, put her in her electric wheelchair, and just set her free? She will make good decisions. Again, the concern was whether we were going against public health recommendations. We talked to the infection control nurse, and an exception was made. In both of these cases, the right thing was done, but it took time. Nursing facilities need a comprehensive plan to enhance socialization. If there's going to be an organized plan to enhance socialization, then physicians and providers need to do a better job of advanced care planning. Larry is an 87-year-old man with a bad heart, bad kidneys, and Alzheimer's dementia. We've spent lots of time talking about code status and hospitalization versus no hospitalization. Larry's favorite activity is sitting by the nurses' station where he will banter with the nurses. He will often talk about his deer hunting trip last week. Intermittently, he'll get restless. The nurse manager will notice this. She's about 30 feet away. Get up, have Larry stand up, walk him 30 feet, turn around, walk back to the chair, sit down, and that will deal with his restlessness. You have to realize that Larry was a foreman in a previous life, and about twice a day, he'd make an announcement for us. And the announcement would be, Larry Johnson needs to use the restroom. Staff would snap to attention. A tub room was close by. They would get him to the bathroom, and Larry was happy. Post-COVID, Larry is confined to his room. He's not interacting with the nursing staff, so he's a little bit more confused. Or is he depressed? He's not getting those short walks multiple times a day, so he's getting weaker. And he's not getting toilet as frequently, so he's wetter. Again, a staff nurse advocated for him. An exception was made, and they moved him to the nursing station with a mask on. But there needs to be a conversation with the family. From the COVID point of view, Larry is safer in his room. The nurses' station is a high-risk area where he's going to have exposure to 2 nurses, 4 certified nurse assistants, the crazy doctor that's sitting at the nursing station, a nurse manager, and anyone else that might be using the staff dining room. The risks are certainly low, but they're not zero. We talked to the family, and they, of course, had no hesitation, get him out to the nursing station. A similar case did not go as well. Mary is a 92-year-old with advanced dementia, and she had been losing weight. Her daughter had been coming to the nursing home for the evening meal to assist in feeding. After COVID, of course, the daughter can't visit. The nurse manager knew that this was going to be a problem and developed a feeding plan. She watched the nurse's aide feed Mary. In fact, the nurse manager often fed Mary herself. The daughter knew there was going to be a problem. She continued to make window visits at mealtime, and she was not happy. The daughter was not happy. Nursing staff were not frustrated, or were very frustrated. The problem was, ironically, Mary wasn't dying, and the daughter didn't meet criteria for visitation, but we had a very persistent nurse manager who made an argument to the infection control nurse that the daughter was an essential healthcare partner. We were able to convince infection control to allow the daughter to visit, and after sitting with her mother every night for a week, she came to appreciate our point of view. Hospice was involved, and Mary died 3 weeks later with her daughter at the bedside. Throughout this time, our administrator was concerned that the daughter could potentially bring COVID into the facility. A family member needs to be considered an essential healthcare partner. Opportunities need to be created for safe visitation. Technology can be helpful, but it has its limitations, and Tom will illustrate this. Tom is a 60-year-old with a vascular dementia and a leg amputation, living at the nursing home because his wife could not care for him safely at home. Before COVID, she visited regularly. After COVID, visitation stopped. Tom began to get angry, depressed. He could not recall why his wife could not visit. What about FaceTime using an iPad? Well, unfortunately, his wife had congenital deafness. They communicated with a mix of sign language, gestures, reading lips, and talking very loudly. What about window visits? Well, that didn't work either, even though it was a large window and we had good walkie-talkies. Before we could make an exception for his wife ended up in the intensive care unit of a local hospital with a respiratory illness. Fortunately, our social work was able to make contact with the ICU staff and use an iPad for FaceTime. I cannot speak for the wife, but after his wife died, I sat down with Tom and he volunteered to me how much it meant to him to be able to see his wife before she passed away. Technology can be helpful, but it has its limitations, and those people who have the most to benefit may have lost the skills and capabilities to use technology, particularly those with visual impairment, difficulty hearing, and those with cognitive impairment. So in summary, in the nursing home setting, those in charge of infection control really need to make sure that they're creating an environment where frontline staff are vigilant, but where they feel safe so they can continue to provide the face-to-face care that they need. Nursing home facilities need some comprehensive approaches to enhance the options available and enhance isolation. And I think we've learned a lot from Dr. Davis about some possible options. Advanced care planning needs to include education for patients and families about COVID-19, as well as the risks and benefits of socialization and participation in group activities. Technologies can be helpful, but has its limitations. And finally, a family member needs to be considered an essential healthcare partner. Opportunities needed to be created for visitation. And with that, I'll close.
Thank you, Dr. Ensberg, for that great presentation using case studies to share how social interactions are so important in caring for the elderly population. If our speakers could turn their cameras on so that we can have questions and answers. For those of you who are in the audience, our participants, please continue to enter your questions, then we will take them now. So our first question will go to Anne. Has there been any effort to connect long-term care residents with high school students? I think creating a pen pal or Zoom buddy program would be beneficial between these two groups.
I think that's a great idea. I'm sure quite a few things have been happening. I know I follow a lot of long-term care facility Facebook pages, so you see things that the children and students have done. But I'm going to reach out to our ombudsman staff and ask them what they know or if there's anything they could facilitate. It's a good idea.
Thank you
I
so much.
pop in here, Jean. One of the things that we did here at Kirkhof College of Nursing was pair our nursing students with older adults in the community over the summer. And we had a pen pal program or a phone call program where they would call residents and kind of develop a relationship with them. And it was a very successful program. I think that the students enjoyed and learned as much from the older adults as the older adults got out of it from the students. So I think it's a great opportunity and a great idea to involve high school students as well.
Dr. Ensberg, did you see any of those types of strategies in the nursing home population?
What comes to mind is that nursing homes have a great resource in public health related to the infection control aspects of it. But I think nursing homes would benefit from a support network of people like Dr. Davis, who might give them ideas about how to use technology. We're caught up in the day-to-day activities and are just very busy. We need support in the nursing home and good ideas.
Wonderful. There's a question about deaths. How are failure to thrive deaths of the elderly due to social isolation and not because of contracting COVID counted? Are they lumped in with COVID or are they tallied some other way?
Is this directed to me?
Whoever would like to answer it, yes.
Often, if COVID is the primary cause, that would be listed. There's a spot on the death certificate where you can add additional factors, and I will often mention isolation or wasting away. Inanition is a word I might use.
But if the person did not have COVID, they would not have a COVID-related death, correct, Dr. Ensberg?
Mm-hmm. And I'm not sure that it's ever mentioned. I don't think we keep good statistics. Better studies are needed.
Thank you. Would it be possible to perform quick COVID tests, which take about 15 minutes to give a result for visitors? I know that in Germany, this is already in place. Could we use that in nursing homes in the United States?
At Holt, they're using the quick testing for staff. They have limited number of tests available. I think it would be a very good thing to use for that family member that's deemed an essential health care partner.
Sounds like it could be really valuable for the patient and for the nursing staff as well. There has been news from Europe that in nursing homes where the elderly were vaccinated, there's a higher incidence of positive COVID cases. Why do you think that is occurring? I know that full immunity requires 2 shots plus 12 days after that. Thanks.
this is a very impaired population. Their immunity is not what it was when they were younger. I believe we're going to need to continue continue to be cautious just because of the population. There's going to be risks and benefits in everything we do. And I believe that patients, families, and the resident councils in the nursing home are going to need to make some of these decisions.
That's not, yeah, I bet that is still a big concern. One of the questions for Anne, some of the resources that you shared with us, the boxes, the meals, et cetera, how do people access that type of resource?
They can call our agency at 456-5664, and we can let them know if there's currently any of those boxes available or going out. It's throughout our 9-county region, and it was, more heavy in the summer and fall, but we can keep figuring that out, and would definitely like to hear from people if they're interested.
Thank you. And Dr. Davis, your research work, are you enrolling subjects or nursing homes, or how is that going?
We're on hold. We, as well as, and we shouldn't be allowed back in if family isn't. And I would like to see family allowed back in to visit their loved ones first and soon. I hope that they are. I think wearing a mask and that kind of thing, and social distancing, having a vaccine, and getting tested are all tools that could be used to have that happen sooner versus later.
Well, I want to thank our panelists again. Thank you so much for your wonderful presentations, the great resources that you shared with us so that we can access them if necessary. I want to thank our participants for joining us today. We really appreciate that, and for all the students who have come. I hope everyone has a wonderful evening. And again, thank you. Have a good evening.